Hello, I see so many myofascial, muscle, and intra-articular TMJ pain and dysfunction cases in my office. And these people, many of them have been wandering in the wilderness of facial pain for years and years and years, going from this doctor and this treatment to the other one, and they don't work. The protocol I developed 25 plus years ago is non-surgical, and it relieves TMJ and myofascial pain and dysfunction. As far as I know, every time. I can think of no patient that did not have resolution, i.e. they're functional and comfortable 99% of the time. That means they can open their mouth wide, they can eat a hamburger, they can close their teeth together, they can sing, and they don't have pain. I wanted you to hear from actual myofascial and TMJ pain and dysfunction patients that I've treated with the protocol I developed 25 years ago. Tell me, just what got you in here? Why did you come see me?
I went to a dentist in Weatherford, and they had done one of the panogram x-rays.
You got from them?
Yeah, but I mean, they had people coming in and looking at it because they had never seen a condyle flattened off. And they said, don't you hurt? And well, I always have, forever. And then after they did that, it was flat on this one side.
Because they did the panogram?
Yeah. They said, my gosh, well, look at this. You need to go somewhere. And that dentist, he told me, he said, I know, why you've got to go to Waco. He said, you've got to go see Dr. Cutbirth. And let me tell you, that's the first thing I did when I got out there. I called and made an appointment.
So what were your symptoms?
Well, I gritted my teeth all the time, and I was always hurting up in here, and my neck's always tight.
Just
headaches.
mainly the right side?
Mainly the right. Some in the left, but mainly the right. And headaches. Headaches.
Now, since you've been humming, does that help the
headaches?
Headaches?
It helps, yeah. When I don't grit my teeth, I've done great.
You've been able to do that?
Yeah.
So you had headaches and you had pain?
Oh, jaw pain up and all the way down.
Down your neck. And how long have you had those symptoms?
So many years, I couldn't tell you. I never knew I had TMJ.
Like 20 years or more?
Oh, yeah.
So yours is different in that you've just flattened out one condyle. You can see the right, so this condyle is flat as a pancake with that little osteophyte right there. The other one looks normal. And you really can't see that on an MRI. What were your symptoms when you came from Weatherford here?
Well, I couldn't open my mouth that wide, but then when I opened it, I couldn't close it.
You couldn't close it?
No, it just took, I had to work at it to get it closed. And when I chewed, my teeth went sideways. I would chew and they'd slide over.
Could you eat, were you having trouble eating things?
I wouldn't eat anything very thick, like a hamburger, I'd either cut it up or you'd kind of move stuff around, and kind of eat it that way.
You couldn't open very wide, and then once you got open, you couldn't close, something stuck? Is that what you're saying?
Yeah, stuck.
And you couldn't eat hard food?
Probably closing probably hurt the worst.
So how do you feel after we've done this treatment? How do you feel now?
It's amazing. For so many years I had it and didn't know it. And I'd have pain all the way up to here. I was always real tight. And now everything is just relaxed. I just don't grit the teeth.
So can you close now without pain?
Oh, yeah.
Can you eat?
Oh, I can eat anything.
Hamburgers, whatever you want to eat? Fantastic. It always works. For 25 years of doing it like this, when I finally figured it out, it works every time, and it really has to.
I would recommend anybody doing it.
If you keep from having to do surgery, my objective
Yeah,
with
that's
these.
great.
As we did the fine tuning today, what do you think?
I can't even describe how good it is. It is just It's amazing.
What is it?
It's
What does it feel like?
heaven.
Yeah.
It just feels everything, it just mellows together. It just, everything fits. It
Yeah.
just, boy, it feels so good. Everybody should come see you. Everybody.
I can't see them all.
Fly in. Do
I can't see 'em all.
something. Oh my.
How does that feel when you bite it?
I can't wait to go eat something.
So perfect is my favorite word. What did you do to get to open to 45, from 18 to 45 millimeters?
You had me progressively add a few popsicle sticks every day or two, and then massage that joint there. About a toothbrush, I could just
Yeah.
barely open.
Didn't you say, I don't think I can?
I didn't know how I could possibly make that joint open wider.
So how did you do it?
So you had me put the popsicles, well, you first did a little shot.
I did
You
a trigger point injection.
trigger
Yeah.
injection. I could open a little wider that day, and then I added periodically a few popsicle sticks every other day or so, and would massage that joint with a little massager. Then each time I would come in, you had a goal for me to try to reach that I would add a couple of sticks.
So how many would you try to add, and how often would you add?
2, I guess. You at least try to get me 2 a week, I think.
2 a week?
2 or every other
Were you able
week.
to do that?
I was able to do what you told me to do.
Right.
I would do it. So
And was it
at
painful?
first it was, but the more I massaged, then it would loosen up a little bit, and I could add maybe 1 more or 2 whenever I came in for the appointment.
So how would you added 1 or 2 every week?
Right.
Now, how would you add them? Would you first go with what you had and massage it, or would you just go commando and?
No, I would start where I was and then massage, and then by the end of that day, that period of massaging, I could add 1. It would loosen up enough, so then that would be my starting point the next time. I can pretty much, as long as I do it a couple of times, a week or so, I can kind of keep it there, really. And sometimes I'm a little lazy and don't do it, and I can still be there.
Now, how do your joints feel now? You have any
Just,
pain?
I don't have any pain at all, except for if I haven't done it for a while, then I'll put sticks in, and then I'll have some pain. So
Great. So how long did it take for the pain to go away? What level of opening did you need to get to for the pain to go away?
just comfortable enough that I could eat a hamburger or, a sandwich.
So now you don't have any pain?
I don't have any pain. I don't have
You can eat
any.
anything you want?
No problem. No, I can do, in fact, anything I was doing beforehand. And I could have some quality of eating pretty early on once you widened it just a little bit. But before I could hardly chew. Couldn't get a toothbrush, couldn't get a sandwich. I'd have to cut my sandwiches into little bites,
Yeah.
and push them in.
How did you feel when you came in here? Why did you come here to start with? What got you in our office?
I had gone to several different specialists and dentists.
In what? In TMJ?
In TMJ.
TMJ
and
specialist.
General, yeah, just like other dentists as well. And everyone had different remedies, if you will, for different night guards and all of the things.
Did you have some treatment at those places?
But treatment, they just gave me a night guard to do. And then over time, it just never really helped and worked. And I never really got better.
How long had you been doing that?
Oh, for years.
For years?
Yeah.
When did this start?
Probably my sophomore year of high school. So
And you're now
6
a
years.
what?
Graduating senior in college.
Graduating senior from college. Okay.
But for most of the time, I didn't do anything about it. I was just trying
Just
to
live
push
with it.
through. I was trying to be tough.
And what were your symptoms?
I've kind of experienced a whole variety. It started with just discomfort, and then I would get locked jaw, to where I wouldn't be able to open super wide. And then
Closed, but you couldn't open.
correct. After that, I had to get a crown on one of my back molars. And
This was done in
experience-
Dallas.
Yes, it was at a new dentist that I'd never gone to before, just a referral. They just didn't shave it down well, I guess. And so then my bite was super uneven. That got really bad. I was grinding my teeth so hard at night that it cracked my tooth. So then I got to a point where everything was just really painful.
Jaw
was
joints,
painful, like
facial pain.
tooth pain, facial pain, mostly on the left side, where like the crown was that I had a bunch of work done. One, I didn't have like a big bite, so it was really hard to eat. And then
Hard to bite down.
every time I had to eat or do anything, speak for a long time, sing, I loved to sing, and I couldn't sing because I couldn't open my mouth, and it just got super painful, and I was having really bad nerve pain. And so that was whenever we decided to come here. It was nerve-wracking to like try something else, and I really don't like dental, like I don't like everything in my mouth because the past however many years have been so painful and just hard. But it's been awesome.
So we evened your bite, gave you an occlusal orthotic appliance. I did trigger point injections, then gave you the tongue depressors to open your bite. Now you can open the 48 with no problem. So are you having any pain now? Nothing?
No.
Can you open wide, chew, everything, sing? Fabulous.
Yeah.
Well, that's what we expect with this treatment.
And back to perfect condition.
All right.
Yeah.
Great. Thank you for interviewing.
I'm super grateful.
Do you remember how you felt when you came in here?
I mean, I was miserable.
Why were you so miserable?
I just had tension in my jaw on both sides, having migraines, and
Are you having any headaches anymore?
when I bite down, my bite feels normal.
Okay.
It actually feels better
Okay.
than what it did beforehand. That's
You're
been
good.
a drastic help.
Yeah. So you having any pain at all? Now, where were you having pain?
Just right here on both sides.
Yeah. Do you have that anymore?
No,
You
it's
can
weird
relax
to
that?
think, you know, how long I went with it hurting.
Yeah.
Doing the little popsicle stick thing and massaging it, you know, when I first did it, it was just so tender.
Yeah.
The tension is not having that is wonderful.
Okay.
During the day, I just didn't know how to stop it from hurting. So now I know not to have my teeth together.
Yeah.
For now, I feel like it's second nature that I'm not worried about clenching during the day. At the very beginning, I had to focus on it.
Yeah.
And now I don't feel like I have to focus on it.
Yeah.
So my symptoms before I started, I had popping and clicking, and then proceeded to popping in my jaw for a year or two beforehand. And then like last October, it's now July, last October, I woke up one morning and like could hardly open my jaw at all, and like spent all that day like hardly eating, and then drove to Dallas to go to my dentist, and he didn't work at all. Like he didn't suggest me hardly anything, and then my voice teacher recommended Dr. Cutbirth, and so I came here.
What did your doctor in Dallas do?
He thought that it was from stress while I was sleeping, like grinding my teeth.
Now, had you had a night guard
No.
ever? Had any dentist ever recommended a night guard?
No. I did know that I had been grinding my teeth. Someone told me that. I don't know, I must have been grinding my teeth a lot that night or something. And so I woke up and like my jaw had like I could barely move it. And to move it hurt like no one's business. Like probably a 9 out of 10 on the scale. It was like right here. Like right there. That's all I could do.
Wow.
I could talk a little bit, and like I went to class that day, and I actually had voice lessons that day, and I emailed my voice teacher and I was like, hey, I can't open my jaw, I'm not coming to voice lessons. And she was like, okay, go to Dr. Cutbirth. And I was like, okay. And then I didn't listen to her because I already had a dentist, and I went to that dentist and he didn't give me good advice. And then I came here. It was overwhelming because they handed me this gigantic stick of popsicle sticks, and they were like, hey, you gotta put this in your mouth. And I was like, there's no way I can put that in my mouth. And then he numbed my face, and then I could put it in my mouth, and I was like, oh, so it's not my jaw, it's my muscles. Like I just need to numb it. It was fine. It was just like the pain that I had overcome. It wasn't like I couldn't open it. It was just like it was really difficult to open it. After that, I was doing like the put it in my mouth and massage it like every day, twice a day, and then and it was fine. It was open. Like he had numbed my face, and all of a sudden I could open my mouth, and it was like, what happened? And then proceeded with stretching and massaging every day. And then I think I had another checkup in like March. It still hurt quite a bit to get it all the way open. It was still like not pain, but like a pull, you know. And so I got all the way open for a while, and then it was like hurting a little bit to get it all the way open by like early June. And then I went to church camp for 2 weeks, and because I was at church camp for 2 weeks, I didn't bring like my popsicle sticks, and I didn't have time to do it. And so then I got back from camp, and I was like, oh, I sure hope I can still do this. And it was like the easiest thing ever to do. And I don't really know how that happened because I wasn't stretching it for 2 weeks, but it's really easy. And I think I just got the okay that I'm good to go on my TMJ, which is super great. And it's only been, what, 7-8 months since like my first like official appointment. 9 months since I had like ridiculous pain in my jaw.
How does it feel now?
As back to normal as I remember it being. Honestly, better. Like, there's no clicking, there's no popping. It's honestly like a miracle. And it's insane, honestly. Like, I can't believe that it worked, and I'm really excited about it. I'm super, super pleased. As I wrote in my sheet, is astronomically better. And I feel like I'm back to normal. And I feel like I'm going to have the freedom to eat burgers and to, sing to my heart's content with correct technique in my jaw, because you have to be able to have full control of your jaw to be able to sing classical music, and that's kind of what I do for a living. Or for my school, and so it's going to be super useful going back in the fall. I think my voice teacher's going to be really pleased with the results.
It started like almost a year ago, and one night I was eating little cherry tomatoes, and I bit into one, and it wasn't painful, but like I felt a pop or something, and I couldn't open my mouth more than just a little bit. After that, it didn't click and pop anymore. It was just stuck. And so at that point, that was when the headaches developed and a lot of facial, neck, everywhere through everything pain. And that was pretty constant. And I mean, there were days that it was just almost debilitating headaches. Just kind of told myself I would get better for a while. And then, took me 6 months, because I'm stubborn, to come in, started treatment. And so there was a lot going on in my mouth. And Dr. Cutbirth said he wanted to start TMJ treatment at the same time that he took my wisdom teeth out. And so he took my wisdom teeth out, and then just as soon as the holes had healed up enough to move forward, we started the TMJ treatment. He had me sleeping in the night guard, and then using the tongue depressors to open up my mouth more and more. And I don't know how many I'm at now, but it's 46 millimeters. And so that's what I'm doing every night. It's still a little difficult to get it in at first, and then once my jaw is relaxing more, it's okay. I'm a rule follower, and Dr. Cutbirth said every 2 to 3 days add a tongue depressor. So every 2 to 3 days, I was adding a tongue depressor no matter what my mouth wanted to do. And so I think that when I left, after that first time, he wanted me to add 6 or 7. And so every 2 to 3 days, I was adding another one until I got up to having the whole set that he sent me home with. A lot better. Range of motion is great. I can open my mouth. It still gets a little stiff when I open it to the fullest, especially on days I've been talking a lot or whatever. I still have some soreness and some headaches, but not nearly like what it was before. And it's been maybe just now 3 months, so it hasn't even been that long. And it's improved a lot. Still have some improvement to go, but it hasn't been that long, and it's improved a lot so far.
Well, for years it had been popping when I opened. The last summer, it started really, really popping loudly when I would bite down, and it was excruciating, really, really painful. And so things like eating bread or pizza, anything that required biting in and tearing, were just out of the question. I mean, I'm a professional singer, and I just figured out how to open my mouth and avoid that pop. And so it really wasn't a problem before then. I'd been grinding my teeth evidently quite a bit, and had a night guard. Dr. Cutbirth, when he looked at it, said that if he was going to design one to cause me pain, that's exactly how he would design it, because it had been from a previous dentist. But so he made me a different one, and things started getting better immediately with the new night guard. Then doing the treatments, it improved. While, because I resisted the treatment. I refused. It sounded really, really scary to actually be tearing something. I mean, this is my livelihood. And I didn't want to do it. And so I had 3 concerts scheduled, and I was going to just go ahead and try to sing through those and not do the treatment, and I couldn't. And during I teach. I'm on the voice faculty at Baylor University, and during certain lessons, especially with students who have jaw tension issues, I would find myself, I guess, mimicking them unconsciously, and I would lock up then too. So it just became apparent that I was going to have to do what he said to do, as horrendous as it sounded. And so that meant I just canceled the concerts. I quit singing. I haven't really sung all year, and just very carefully approached my teaching and just did it. Well, there really wasn't an option. Was when it was locking up, I mean, what was I supposed to do? Work in a gesture, to loosen my jaw in the middle of the recital? I mean, there kind of wasn't any other option. But I have not had any problems during teaching whatsoever. It's just quit locking up, and there's no more pain. There's no more problems when I'm eating or anything. So it really is considerably different. I don't have any pain when I'm eating, but really not any pain. So that's very, very different.
Afterwards.
I'm 52 years old, and all the way back in my 20s in graduate school, my jaw, anything to do with my singing that was problematic always went back to my jaw. And so I learned how to open my jaw to where it wouldn't pop. I compensated for that. But then last summer, a year ago, it started popping really badly when I was closing, when I was chewing, and the pain was just, I had to get some help. I couldn't compensate anymore. But in the last several years, the transition between the middle register of my voice and my high voice, I was having trouble tuning that. And I just thought it was age-related, and, that I was nearing the end of my singing, and I'm not having that problem anymore since the treatment. So I really think that I couldn't get things as open as I needed them to be to sing in tune into the high voice. And so now I can. Now I'm rehearsing an hour and a half a day, getting ready for a recital. And this includes lots of high notes that really are making me open as much as I can. And it's terrific. In fact, it's better than it's been in the last 10 or 15 years. So I was thinking some things were happening with my voice just due to natural aging that actually I think were more about my jaw. So it's very exciting.
So before treatment, I would get a headache every 2 weeks that would last about 3 days. And I've had this problem since I was about 19. So I had popping and clicking for a lot of years, but eventually the popping and clicking stopped, and my mouth would only open about 2 fingers wide, and I couldn't even pop it past that. And just a lot of tightness in my jaw and also in my neck muscles. And the headache became the most bothersome part.
How long ago was it that we started your treatment?
2 weeks.
And what have your symptoms been like since you began treatment?
My muscles feel a lot more relaxed, especially in my jaw. My neck muscles, I'm still working on it. They're still a little bit tight. And my headaches have lessened, and I can open up my mouth. I'm doing the physical therapy that was prescribed, and I've been able to add a lot of popsicle sticks, or a lot of width. I guess if I had to measure it the same with my hand, it's maybe 4 fingers wide. I only have 4 more popsicle sticks to go to reach my goal. So I'm feeling a lot better.